Hello, my name is Lauren Dellinger, and our healthcare company is called Breakthrough. These are the different slides that we will be presenting today. Breakthrough is a bridge program that is an alternative for inpatient treatment. The same services for inpatient treatment are provided, but at a smaller, more intimate setting. Our inpatient facility would be the first phase and the first 30 days of treatment. So these first 30 days in the facility will offer treatment as needed for health and giving guidance and support from doctors, therapists, meeting with groups, things like that. And also have mentors to help with things like applying for jobs, applying even for credit cards or things like that. Anything needed by each individual person, and just helping them get on their feet. And then after those 30 days are up, they'll transfer into a home setting. So they will have a home to stay in, and they will have the choice of having roommates, so more like a group home setting, or just being by themselves if that is what they need. Their mentors that are assigned to them will be checking on them daily, offering any help that's needed, still along the lines with jobs, and things like that. So also they're going to have weekly drug tests, just to hold them accountable for their place in their home. And um, also there will be a daily curfew of 8 p.m. every night. This gives them more of a normal, stable lifestyle, um, and they can move freely about their day every day and not feel like they're forced to stay in one spot every day. And a lot of programs will have them stay there. They can't leave, or they need a special um, form filled out and a good reason to leave the facility. But this is more of a facility where you're going to hold yourself accountable, and this is where you want to better your life, and you want to um, get a better life going. Okay, so our vision is maximizing the well-being of humans. So just creates this creates a mindset of being healthy, happy, and safe for all of our patients that we get. Providing an environment for a better life. People who are in search of a better life, more specifically, this just provides a safe environment for them, a comfortable environment for them. A sense of community by helping others. So this is bringing Napa just a sense of community to, people who may not feel like they're a part of the everyday community, or need help in getting back to that. Um, so networking with local community. Um, this is partnering with people and just getting to where we have the best opportunities possible for our patients. And this holds each patient accountable, um, and just being the best citizen that they can be, and be accountable and beat the odds that they're trying to beat. Our corporate mission statement is humans helping humans. Let's do this together. This is, we would just like people to help people and get through the hard times together, by people who have been in the same spot that they've been in before. And that's another That's another thing with our mentors is they are people that have been in this situation before, and they have gone through this and they are thriving out of it.
Hi, I'm Marjorie Castillo, and I will be presenting our 1 to 10 year plan and our employment policies. So we broke our 1 to 10 year plan up into year 1 to 5 and year 5 to 10. So for year 1 to 5, we just want to get started and reach out to our local communities and get ourselves out there and and show them we exist. And we want to possibly get donations, um, such as like food, clothing, shoes, and basic necessities that patients need, or are we're not fortunate enough to get before they were here. We'll have it for them ready. And we also want to pitch our plan to the mentors. Our mentors are people that have been through addiction before, so they'll know exactly how to help our patients today. And we also want to bring in volunteers to help around for the in-home treatments and to help our mentors when they need it. And we also want to reach out to local organizations. Like I said, we want to get donations since we're a nonprofit company. We'll need to have a way to pay our expenses to be successful. For our 5 to 10 year plan, we will start our in-home treatments, such as the individual therapy and checkups. We'll start providing the necessities we got from the community to our patients that need it. And we'll also start our programs such as our career focus training. That is like teaching the patients how to get back on their feet and doing resumes and cover letters and how to do an interview. And that's kind of the same thing as the 2 to 4 year life planning. So if they need to get back up on their feet, they could join our program and to know where to start after they if they decide to leave our in-home treatment and is ready to get back on their feet. So for employment policies, we want our employees or our volunteers to at least work for 40 hours a week. They could have 2 days off. Of course, we want equality and diversity in our business. We need respect for our staff, no matter what age, gender, or background they're from. We want everyone to be healthy and safe. So, maintaining a clean, healthy environment for everyone. For the pay, we have a potential yearly bonus. Since we're a nonprofit company again, we need to find a way to pay our volunteers. So if we have enough donations for that year, we'll give it out to our all of our volunteers. We abide by confidential information since we are kind of like a hospital and like the medical field. We have to be confidential in everyone's information that includes personal data, the staff's payroll, bank information, home addresses, and the patient's medical records. So employment policies continued. For we needed training and development. Under training and development for our volunteers, since we are treating patients with addiction, we don't tolerate smoking, drugs, and alcohol around us when you're on the job. We don't tolerate bullying and harassment, so we are gonna give out training classes on how to handle bullying and harassment. We also plan to give our volunteers dismissal and grievance when needed.
Hi, I'm Kaylee. Our management style is permissive democracy. All of our decisions are made all together. We want everyone to have an equal say in how our business is ran. So all of our decisions are made collectively and made all together. We like to encourage people to try new things and new techniques in order to create a successful environment for everyone's unique style, allowing for professionals to use their own judgment when doing their job with the encouragement of the founders. For example, we like to encourage our therapists to use their own judgment on the therapy that's needed. For example, the cognitive behavioral therapy, the dialectal behavior therapy, the eye movement desensitization and reprocessing, also known as EMDR. We want them to be able to almost have free range of how they use or what style they use. Our founders, our foundation is started from founders, the people who created the breakthrough. We also have physicians and therapists who work then alongside with us. We generally need their help to help treat patients and how we can further assist them. We also have nurses and pharmacists who help out our doctors to help achieve the goals of our patients. We have CNAs as well that help the nurses and are available when need. On the whole other side of that, we have the community outreach, where we have encouragement and help from the community. We have mentors and also accept donations. They kind of fall along the same thing or along the same lines. Since we are a nonprofit business, we need to find, or for example, we need to find a way to pay our volunteers and handle all of our expenses. As for the mentors, these are the people who are going to be a role model for our patients in recovery. And generally, we like to have people that have been through this before. And then under our mentors, we also have volunteers, like the nurses, the doctors, people willing to help with the extracurricular sort of things, extra support, giving guidance, people that understand and have knowledge of how the addiction process works and how getting clean works. We also have a clothing and sort of food bank. We need all of these sources to give people the necessities they need to live a healthy and clean life moving forward. Then the services we provide, we have in-home medical treatments with physicians, nurses, psychiatrists, dietitians, pretty much everyone that we may need to get clean successfully. We have therapy for individual people, family therapy, group therapy, just to, again, kind of give people all the support they need. We also have extracurricular activities, meditation courses, outdoor activities, cooking classes, writing courses, art, poetry, just to give people purpose and to get them on the right track. We also have career workshops where, we work on resumes, where we help explore new things that they possibly might be into, help them prepare for the interview process, find the right clothing, get them ready and set them up for success.
Hi everyone, so my name is Kat and I will be talking to you guys about the communication style here at Breakthrough, the culture at our organization, and our staff and volunteer benefits. So our communication style here at Breakthrough is a horizontal communication, which just means that the superiors are able to talk or communicate with the subordinates, and the subordinates are able to communicate back to superiors. So when dealing with a conflict resolution situation, it's important for the parties involved to come together and just discuss or talk things out and find a solution or a common ground for the conflict. And it's important that they communicate effectively because we want to make sure that they are on the same page when treating a patient. So task coordination. Task coordination is the delegation of specific jobs, and usually here at Breakthrough, it's a superior communicating to a subordinate what they need to do. And it's important that when the superior is communicating to the subordinate, that the subordinate understands what they are being asked to do, because we want to make sure that the progress of the patient is running smooth and steady, and we don't want the confusion from the individual helping them to kind of delay their progress. And so, not to say that there won't be bumps in the road, because there will be, but that's when problem solving comes in. So when solving a problem, it's important for the parties involved, again, to come together, kind of talk things out, find out what's the best solution for this problem. And so that can be either coming together and coming up with a new solution, or just implementing a new plan that was already thought of in case something like this happened, or if something like this had happened. So in order to come together and be on the same page and just effectively communicate, staff with staff or staff with patient, it's important to establish good rapport. And so we want to establish good rapport because we want to have good, effective, both nonverbal and verbal communication. And this is important to us to have because we want to make sure that when us, the staff, are talking to a patient, that the patient understands, and that when a patient is talking to us, that we understand what they want, their concerns, whatever it may be. And so when we're sharing this information, whoever the parties may be, it's important to have good communication skills. And that's listening, talking in a manner or in a form that they understand. And it's important to have because important information is being shared here all the time. And we want to make sure that we, the staff, understand, and then that we can communicate those concerns to our superiors, or we want to make sure that the information that the superior gives to the patient is being comprehended by the patient. So the culture of organization consists of emotional support, achievement awards, conflict tolerance. We're compassion based, and we offer opportunities for growth. So while at Breakthrough, we'll have many patients coming in for many similar reasons. We understand that no two patients are alike and that each patient does have very specific needs. And so because every patient is different, they'll have their own specific needs. Some might find it harder, more difficult than others. And because of that, our staff is available to provide them with emotional support as well. So we have achievement awards, and these awards are just used to recognize milestones or accomplishments that our patients have done. And they're awarded with positive feedback to boost their confidence during and once they have completed our program. So conflict tolerance. Conflict is a natural part of the process that comes up, and it's totally understandable. And we let the patients know that it can be addressed or solved with positive tools that our staff has learned that then we teach to the patients in order to kind of let them know that they're not the only ones who've gone through it. There's many like them, and that they can overcome the conflict. So compassion-based, we're compassion-based. What does that mean? So it just means that we believe the best in people and we see the best in people, and that's defined by how we treat people here at our facility and how we kind of make them their own specific plan to complete the progress. So we offer opportunities for growth, and our patients are just constantly learning life lessons and life skills that they can carry out beyond into the real world. So that means like how to write a cover letter, how to fill in a resume, how to create a resume, how to fill out job applications, just things like that. So our staff and volunteer benefits consist of long-term and short-term insurance, and it includes health insurance, dental insurance, childcare benefits, and gym memberships with discounts, and time off for our volunteers. So with health insurance, it kind of just consists of the basics like getting your vision checked, doing your annual checkup, things like that. The same thing goes for dental insurance. It's just kind of like going to get braces, fillings, a cleaning, like that. For the gym and childcare benefits, for this, it's actually a dollar amount towards each. So there's only like a specific amount that we can provide up to. And for the 3 to 6 months volunteers, so our volunteers can bid for time off, and it ranges from 3 to 6 months off. And for the staff, there's paid time off. They have a limited amount of sick days and a limited amount of vacation days. And so the salary for our staff is more of a end of the year bonus. So whatever the program doesn't use up, we give to our staff and our volunteers, and that's kind of how they get some money made from here.
Hello, my name is Ajane Holmes, and today I'm going to be talking about the budget for our group organization, and our organization is Breakthrough. Our organization actually predicts for our budget that our total operating expenses are going to come out to $15,600 for 1 year. This is including $10,000 for advertising and promoting our services. And I believe that advertising and promoting is going to include paying for commercials and airtime, also paying for spots on buses, bus stops, billboards, also paying for spots inside the paper and also in magazines as well. And our other expenses of product is going to be $5,600 as we predict. And also for this budget for the year, please keep in mind that our local and state yearly contributions are also included in this budget alongside with grants to help jumpstart our expenses for operating for that year. Our general and administrative expenses of operating will include $3,500 with $0 for payroll and including $3,600 for utilities, which we believe will be including power such as lights, television, and internet services for our guests and for our patients to make them comfortable. It's also going to include clean and running water for drinking water and for washing up, showering, and bathing for our patients, and also safe and functioning heating and cooling systems for everyone. And also other needs to keep our patients here safe and to keep them comfortable, asking them what they would like in our facility to make them feel more at home than to feel like they're trapped somewhere where they need help. Our liability and health insurance to ensure that when things do go wrong, nothing is non-repairable for our patients or for the facility itself. And that's going to come out to about $20,000. Our rent to stay in the building and for us to keep functioning properly, we think annually will come out to about $55,700 and $2,200 monthly for this. And all of that also comes up to $82,200 per year for those expenses, by the way. We also took the liberty of totaling up other potential expenses for the year for our patients. And all of that comes up to about $4,000. And all of this for the patients are going to be including clothing if need be for them. Also certain machines, medical machines for us to keep watch of our patients, like getting control of their heart rate, their blood pressure, their oxygen levels, and also different types of medications for the different patients with the different treatments that we are providing for them as well. And that is all for our budget. Right now, I'm going to hand it over to John so that he can talk about the aesthetics of our facility, and it's going to wrap up for our group. Thank you.
Hi, my name is John Moore, and I will be finishing up our presentation today. But first, I want to touch on a few more topics before closing, and that would be our aesthetics and also some marketing and how to implement that. So if you can see on your screen here, we do have an example of a blueprint that is one of our homes. They can be anywhere from 2 to 4 bedroom homes. Just like any other home, we want it to feel safe and comfortable. Within that home, there is living room, a kitchen, a dining room. Sometimes there is an office, but if there is not an office, there will be a communal space for a home computer. There is also an outdoor living space and a gardening space. So we would encourage people that are in our facility to feel and like we said, this is a 30-day at-home safe space, sober treatment facility. Would be a doctor on call, a nurse on call, and there would also be space for a little bit about that, a little bit more our next slide, our marketing. So who is our target and what are the needs? So of course we are focused on the community of people that are seeking help, those that are suffering from alcohol and drug abuse. So why are we different from, let's say, an in-house treatment facility? Usually with an in-house treatment facility, maybe through Kaiser or another organization, most of those places only take a certain amount of insurances. And also some treatment facilities are privately owned, so they don't take treatment at all, or treatment insurance at all. So that's where we come in. We would pick up where others are not able to carry certain type. Also, how are we different than, let's say, a halfway house? A halfway house typically is funded by the government and is generally and historically been reserved for people that are homeless, that are looking for a safe haven, but there is no rehabilitation in those facilities. And then also sober living house. Now that is also going to be very similar to what we're doing here. However, a sober living house is usually for 30 days. Usually people might be court ordered to be there. There is some responsibility as far as chores. However, there is no in-house treatment, meaning there is no growth for recovery within the home. So that's where we come in. We are there to focus on the needs of mental needs, the emotional and physical needs of the people that are in the home. And we do that by having mentors coming into the home to do group therapy. We have doctors that are on call, like I mentioned before, and also nurses on call. And then also pharmacy that can make deliveries when those patients need the medication that they need. And so lastly, we want to talk about, our main focus that we talked about in the beginning, our mission statement was humans helping humans, let's do this together. Now, we are humans and we do have a need to help other people, and that's what we're going to be here for. Our hope within this community is to have the individuals learn responsibility, accountability, and some self-actualization. What I mean by self-actualization is giving them the strength to be able to realize that they can do things on their own. Because when they're done with our facility, then they can go into a sober living house, a transitional living. They can live on their own. They can continue to go to meetings and they continue to get the support that they need. So there's aftercare that's involved, and we have that in place. Now, while they're here in the facility, there are some rules, and the rules are there is a curfew, and there is a house meeting every Sunday night to discuss how the week went and to discuss dividing the responsibility of chores within the house. This is teaching people responsibility. It's teaching people to show up, because in their old life, the responsibility and accountability just wasn't there. So this is really teaching people on how to get along with others and how to be a contender in society. So in closing, I would like to talk a little bit about, once those people do become contenders in society, then they can become mentors, then they can become someone who will be able to help other people. And that's the goal here. We're here to help other people. So we're very passionate about what we've done here. And we hope that you realize that too by listening to our presentation. We look forward to hearing from you in the future. Thank you very much.